Welcome to Thriver Talks with Stephanie and Nalie. I'm Nalie.
And I'm Stephanie.
And today is episode 20, Sex and Cancer.
Woo, we are at Miami Breast in Miami, and Nalie just gave a phenomenal speech. I did my little patient keynote, and we are so honored and privileged to have Dr. Kristin Rojas here today to speak to us on the topic of sex and cancer.
So, without further ado, here's episode 20 featuring Dr. Rojas.
Wow, so we are here in Miami and learning so much about breast cancer, what's on the horizon in terms of treatment, pipelines. Nalie just delivered a phenomenal message about the importance of doctors giving their patients hope. I spoke about being your own best advocate as an MBC patient, but now it's time for the fun stuff, or maybe not so fun stuff, but
no, fun stuff.
It's fun stuff.
But also stuff that I think so many of you who've been listening to Thriver Talks, who've been following our journeys, constantly ask us, Stephanie, Nalie, what do we do? Like, where our libido is non-existent and sex hurts and I feel bad for my husband, my boyfriend, my partner. What do we do? And then Steph and I are like, I don't know. Because we need to know what to do too, which is why we have Dr. Rojas here.
Yes. So really quickly, a brief intro to Dr. Rojas. I went to Maimonides Hospital maybe like 5 years ago, where Dr. Borgen uncovered my misdiagnosis, saved my life, and I do my follow-up appointments. And in one of those appointments, I met Dr. Rojas, and she's amazing. And she's an oncological breast surgeon, right? I mean, that's pretty badass. Yeah. And not only does she do surgery for breast cancer, but she also has taken a special interest in intimacy for us patients who are struggling, right? So can you tell us a little bit about that?
Sure. So first of all, thank you so much for having me. I am so honored. I enjoyed your talk today so much, and you guys are so inspirational for
thank you.
Not just me, but I know that all of the providers here are just, it's so amazing to hear the patient perspective, and it really drives everything home, but also keeps us in check. And I know I've learned so much from talking to you guys about your perspective and everything. So thank you for having me. Yeah, so that day that we met, Stephanie, I was a breast surgery fellow. Dr. Borgen, who's your doctor, is my boss. And so that's how our paths have crossed. And I am a breast cancer surgeon, but I originally came from a GYN background, whereas most breast surgeons are general surgeons that do extra training in breast cancer surgery. I started out as GYN and then kind of crossed over into breast cancer surgery land, so I do both. The majority of my practice is breast cancer surgery, but I started this sexual health after cancer program as a way to kind of stay,
and
I guess, my
it's
roots.
Called MUSIC, right? So it's an acronym for, what is it?
Menopause Urogenital Sexual Health and Intimacy Center, or Maimonides Urogenital Sexual Health and Intimacy Center. I wanted it to have an acronym because I started the program and I didn't want, we have patients of all ages, and so some patients may be really comfortable being referred to sexual health clinic, but probably not everyone. And so I thought it would be a good idea to have an acronym that was something really non-threatening, and who doesn't love music? And so we came up with a lot of different options, one of which was MUSH, when we decided
I think you told me this.
Was probably not the best one. And then music was what we came up with. And then we, and the rest is history. So
So I'm curious, why did you have an interest in sex and cancer?
And for us,
being a breast surgeon and all, where did this interest peak?
Yeah, well, as a gynecologist, I think in order to be a gynecologist, you have to kind of be someone who is really comfortable communicating with women at like vulnerable times in their lives, whether it's having a baby or getting an ovarian cancer diagnosis or having some other embarrassing or specific issue that you maybe wouldn't talk to everyone about, but you would want to talk to your gynecologist about. And I've always really liked being in that role because I like to advocate for women, but also troubleshoot about sensitive and things that are like taboo topics. And so when I started working with breast cancer patients when I was still in residency, I realized that almost all of these patients have these issues. And I saw that when patients finally like mustered up the guts to bring it up, no one knew how to address them. It was like, oh, we'll refer you to this, or oh, try Replens. That's like the go-to, Replens. But I'll tell you that like Replens is not what I recommend for everyone, and it's not for everybody. But yeah, there's like it's a complicated problem. And I thought to myself, like, if anyone's going to be someone who addresses this super common problem that we don't talk about and addresses it in like a non-threatening way to try to make it something normal that we all talk about, I was like, that should be me. Yeah. And so it's been really rewarding. The majority of my practice is breast surgery, but twice a month is the music program. And the visits it's like a clinic, like a one-on-one doctor's visit, but the new patient visits are an hour. So I like can bill for time. Yeah. So that, we keep a roof over our heads, but it's nice because we only talk about that. So I feel like, whereas in my breast program, we are, really, really busy. And so, you only have a couple minutes to talk about really complicated topics with patients, but sex is even more complicated. So having more time to sit down and be like, okay, we're just going to address these issues is huge.
It's so important. I think so. Maybe like rewind, maybe like 6 months ago, on our platform that Thrive Gang that my best friend and Amanda and I created, we did a Thriver Sexual Health Week, which was just kind of like a fluke. We kind of just threw it out there, not knowing what the response would be. But it was really interesting that we spoke about very common issues like vaginal dryness, low libido, painful sex. A lot of people were in our DM. Like, I couldn't even keep up with it because a lot of women were afraid to comment in public under the pictures. But there was such tremendous feedback that we thought, like, it's not just me. It's not just Nalie and I having these behind the scenes conversations. It's all of us. And one thing I found really interesting was there was a statistic that kind of like sticks in my head that I forget how many millions of women have breast cancer, but it was like there's only 30 or 40 professionals in the entire country who are like qualified to talk about this topic, which is pretty sad.
That's crazy.
Yeah.
And you being one of them. So that was like...
Hopefully there will be more. And the crazy thing is, it's you don't really need to be qualified. You just need to have an answer that's reasonable and not dangerous, and I feel like even me starting the program 2 years ago, I was like, oh, well, I'm an expert in women's health and I know all the answers. But it's crazy because every music clinic day where I meet like 5 or 6 it's just for women, this program. So 5 or 6 new women, and I learned something from patients all the time. Me being a young woman, I think I know, a lot about sexual health.
As a sex expert.
Yeah, I'm not a sex expert. But let's just get that out the table. I am not claiming to be a sex expert. And in fact, like sometimes I'm like, there is probably someone who is an expert in that specific aspect, and it is not me, but I'll figure out who it is. And that's kind of a lot of the work I do is like navigating resources. Yeah. So anyone can address some of these issues. You don't necessarily have to be like certified for it. So that's, I think, really important.
So for anyone who feels isolated and they have all these sexual problems due to cancer treatment, maybe to bring them out of that isolation, can you give us a brief explanation as to why do we feel this way?
Yes, there's a reason, and you're not alone. One of the most powerful aspects of this, like I give some talks that are patient focused, and it's so crazy because women come and they have, usually like it takes more than halfway through the talk before they'll like raise their hand and ask a question, and then like 10 other women in the group are like, oh, I thought I was the only one. And it's so crazy. And that's why I think y'all's group is so powerful. And Stephanie, you also encouraged me to start an Instagram just for the music program.
Yes, and tell everyone what that is.
So it's at music, MUSIC_sex after cancer. So it's a Instagram just for these issues that come up. You can DM me, you can comment. I try to put just a lot of information on there for things that we don't always talk about, new products that I try, or issues that come up and things that I learned. So, but that's really super important, is that you're not alone. More than 80% of women, not just breast cancer patients, but
cervical,
all types of women with cancer experience these issues, and we're not talking about it. And we need to start talking about it because it's a normal part of your life. And the big thing is that if you are feeling scared or these issues disrupt your support system. So how are you going to get through the hardest time of your life if you can't even like if you have a partner but you're having all these issues, like the amount of extra stress that adds to your life is insane, and it's not right. It's actually really messed up. And so we should really be paying more attention to all of these other side effects and all these other things that happen during treatment. Just my full soapbox.
No, I mean, that's 100%. Like, thank you. But my question is it just...
How did we get here?
And like, well, is it just women with, like, in terms of breast cancer? With ER positive, is it only women who are on these hormonal suppressants that experience these issues? Yeah,
so it's actually not. So first of all, just having chemotherapy as a young woman or as a woman around the age of menopause, which the natural age of menopause in the United States is 51, 52. So chemotherapy shuts your ovaries down, either temporarily or permanently. So it's normal to have estrogen circulating in your body. It gets high and low depending on the time of the month. But when you take that estrogen away and estrogen comes from the ovaries, all of a sudden, it's like a drug withdrawal. It's like your body is used to having a margarita every day, and then all of a sudden it doesn't get...
I don't have a margarita every day. I wish I had a margarita every day.
But all of a sudden your body's used to... Estrogen plays a big role in a lot of different aspects of your health, like your brain, your heart, your bones, and not just, your vagina. It's all of that as well. And so when all of that estrogen is... Your body doesn't see that anymore. It's basically a drug withdrawal. You have hot flashes. You start to have vaginal dryness. And we've always talked about vaginal dryness, but the more I learn about these issues, the more I learn it's a lot more than that. It has to do not just with dryness, but like pelvic floor muscle dysfunction and atrophy, which is, gosh, it's the worst word.
Well,
ever.
Cool, because that's what I've been told I have.
It has an even sexier name now. It's called genitourinary syndrome of menopause, or GSM, which is super sexy.
Great. Cool.
But the good news is that, like, the more that we address these things, the better the industry will respond and come up with solutions for patients who have restrictions. So it's not just the estrogen blocking medication that breast cancer patients often are prescribed, but it's chemotherapy. And then because it shuts down your ovaries, and your ovaries never fully recover, they're always kind of like bruised. Things may be a little bit different. Your periods may be irregular for a while, and it causes all these different changes. And then the other issue is women who maybe have like a history of cervical cancer, colorectal cancer, they also get like pelvic radiation. And so that can play a huge role as well. The anatomic medical aspect of it, plus all the psychological aspects of a diagnosis and a treatment, and all of the uncertainty and stress associated with that is just like compounds into a really big problem that we're not addressing.
Damn. So before we discuss the solutions, maybe we can break the ice and actually address the issues. So Steph, what you speak of atrophy and all that, but what else do you experience?
Well, to be totally transparent, I've been in menopause for 9 years. And I've been told by my past oncologist that I basically have like the sex drive of like a 90-year-old. I really hope Mark doesn't watch this. But that you have like the sex drive of a 90-year-old. And when I had my last pap smear, she told me I had atrophy. So I think like the most common problems that I've experienced and that also came up when we did our Thriver Sexual Health Week was painful sex, vaginal dryness, and low libido. Mm-hmm. So personally, I have low libido. So I don't have, like, it's like that switches off. I'm not so much an initiator anymore, which is really hard to admit. But when it comes time to be intimate with my partner, I luckily don't have too much pain and I can have sex normally, but I lost my libido or my I don't initiate, which has been a problem. But luckily I know like so many women said it's very painful. I haven't really experienced that, which I'm very grateful for. And even though I have atrophy, I definitely don't have like as much wetness as I had prior. I definitely feel more vaginal dryness, but I guess all to say I don't have it as bad as it could be, but I do experience on some, like all three of those to some extent.
They're all related, and I feel like patients have kind of different flavors of each aspect, and they're all part of each other. Like you could start to have vaginal dryness and then get pain, and then having pain elicits this like negative feedback in your brain where you, without even realizing it, you're like avoiding sex or it causes anxiety. And then it's like this awful cycle.
That's exactly what happened with me. So everything Stephanie mentioned, all of the above, but I do have that pain. And because of a really painful time, it made it psychologically unpleasant to have sex. And so also not just for me, but for my partner, where he's the most amazing partner I could have ever dreamed of, but his goal is not to hurt me. So he is so
for them.
It's so stressful for our partners. It's crazy. So because of that, on top of not having any libido like you, it's like you don't have libido because then you associate pain not with pleasure. I mean, sex not with pleasure, but pain.
Right. Yeah. It's challenging. I think it's so brave of you guys to say that. I do want to tell you that it's crazy. The more I talk and like bring these issues to social media, it's women who don't have a history of cancer write in also and say, oh, I have these symptoms. And I think like as a culture, we don't do a good job of addressing these issues. And just menopausal women.
Even without cancer.
Without cancer.
Menopause, yes.
Yeah. And so when younger women or, it happens suddenly, like we're super ill-equipped as a culture and as healthcare providers to manage these issues.
I feel like we're barely starting to like scratch the surface and have these conversations.
Definitely.
And it is hard to like say, that I have no libido onto the world.
Yeah.
But one thing that really stuck out with me, and we'll get to the points, is that, so I guess we can talk about like our first point, which would be vaginal dryness, right? So that was one of our most common things that came up on our Thriver Sexual Health Week. But something you said that I'm still guilty of today is that every time you get out of the shower, to use single ingredient organic coconut oil and moisturize as if you're putting lotion on your body.
Or your face.
Yes.
Yeah.
Which we do so well, but like we forget.
Yeah, your under eye cream, just like you maintain your face, you have to just completely change your mindset and be like, okay, this is something else I just add to my regimen. So your skin is most likely to absorb moisture right after the shower, which most people shower at night or it could be in the morning. But I tell all my patients, one of the first things with dryness and pain is to just start avoiding irritants. So be really cognizant of what you put, what touches that area, which is the vulva. So avoiding detergents that you wash your underwear with that have like parabens, fragrances, dyes, even toilet paper, panty liners that have a lot of extra stuff. Just like once that skin becomes estrogen deprived, it's super, super delicate. And a lot of what exacerbates these symptoms is like a low level contact dermatitis, which is like an allergic reaction of that delicate skin. So the first thing is eliminate irritants. So that even means like don't sit in a bathtub with a lot of bubble bath.
I probably take like 4 baths a week.
You can take baths, just use like an oil or something instead of like bubble bath with fragrances.
What about bath salts? Like, is that okay or no?
I think it depends on the brand.
Like a pure Himalayan bath salt.
I think it depends on the brand. Like you don't want something with a lot of extra gimmicks. And that's like kind of my go-to, like with the theme of everything I do is try to avoid all the extra nonsense.
Okay.
Yeah. And so a lot of so vaginal moisturization is key. That's like the first step for everyone. And you do it every day, just like you put on your eye cream, you moisturize your vagina. But the way you do it is you can use single ingredient organic coconut oil because a lot of women already have it in their
pantry.
House. Yeah. Yeah. There's also studies on olive oil, but I just like the concept of coconut oil better. Yeah. It is solid at room temperature. You take a little bit and like rub it in your fingers till it's an oil. And then you don't need to go crazy like putting it all the way inside. It really just needs to be like kind of on the outside. And then in like the labia minora, which is like kind of inside but a little bit towards the back because that's where a lot of women have pain. You do it at night and then you go to bed. It kind of works its way up on its own because you're like horizontal.
We need to really like commit to this as part of like hygiene
Set an alarm.
practices.
You brush your teeth. Like everyone brushes their teeth every day, or I hope everyone's brushing their teeth every day. You should be brushing your teeth. Do the same thing. And so single ingredient organic coconut oil is good. I tell patients if you wouldn't put it in your eye, don't put it on your vulva. So like that's a good go to. I feel like if you got coconut oil in your eye, it would be fine. Well, I don't know. But the other thing, so I start there, or the next step is vaginal moisturizer with hyaluronic acid. So, which it sounds scary because it says acid.
Sounds like facial.
Yeah,
something.
it's the same stuff. So hyaluronic acid are these molecules that pull moisture from the environment and hold it onto your skin. So there are a couple different brands, vaginal moisturizers, that have that. One is Hyalogyn, Hyalogyn. It's on Amazon. And on the music Instagram, I have some coupon codes.
Ooh, she's so sweet.
And then the other one is, I don't like Vagisil or products, but they have one product that's called Pro Hydrate, and that has hyaluronic acid in it as well. And then the last one that I think works really, really well, the problem is cost, is these little suppositories, which are like little wax pellets almost you place in the vagina 2 or 3 times a week at night. And they're by a company called Bonafide, and the product is called Reverie. And the only thing is, it's I don't know how much it costs per month, but maybe it's like $40 or $50. There's coupons for that also, and that's like a good company. They have a lot of other good hormone-free products, but that's another option. So I start with those because none of those things have hormones in them. And then I try to talk to patients about how moisturization is every day, but then lubrication is before sex. So
would this be part of painful sex or still vaginal dryness?
I think it's all related.
Yeah.
I think it's all related. And so one issue that a lot of patients tell me is they'll say, oh, they're using like a moisturizer before sex. And so like using something like Replens, which also has like a film on it before sex, maybe isn't the best thing. You want something that's going to be as slippery as possible. Mm-hmm. So there's silicone-based lubricants and water-based. I like silicone-based because they last longer, they're less sticky. But people that have like silicone issues, you can use water-based as well.
I heard someone say that moisturizers are for maintenance and lubricants are for lovemaking.
That's perfect.
And that's how I remember it.
Can we make that into a bumper sticker?
Absolutely.
Or maybe I'll tattoo it somewhere on my body in solidarity.
We can all do it together, have the same tattoo.
That's really important. It's like this is for one thing and then lubricants are for another. Yeah, exactly. So same thing with lubrication. Just like moisturizers, you want to avoid all the gimmicks. So like nothing that tastes or has a warming whatever, or like you want to avoid all the like really exciting looking things and just stick to products. Basic stuff. Yeah. And so there are a lot of good brands out there that avoid all the extra stuff. One is Good Clean Love. Uberlube is my go-to silicone-based lubricant that just doesn't have all the extra gimmicks. And so no parabens, fragrances, dyes, etc. And so for the rest of your life, like that's just what you have to do. You know, like
deal.
Yeah. Seriously.
You know, it's people are like, oh, well, I sometimes do it. It's like, no, even if you're just thinking about it, like use it for everything.
Mm-hmm. It's true. And like you said, like everybody should be doing this even without cancer.
Yes.
Right.
Yeah. It's all these things are good to know, even without
a cancer diagnosis.
Yeah, exactly.
So I guess then the thing that I struggle with mostly is low libido. Mm-hmm. So is there anything I can do?
Is there hope in that department?
Yeah, there is hope. So first of all, one other thing I wanted to say is that like how many virgins how many virgins are listening? Because this is for you. How many different
versions?
How many different versions of Viagra are out there? There's like 5 or 6.
Us?
Yeah, exactly.
International Women's Day tomorrow.
Oh, thank you for reminding me.
Wow.
Maybe we'll
fight for more versions.
More versions. So, so, and the other thing is, like, when men are diagnosed with prostate cancer, they've done studies looking at how many of them, like, on their first visit are told that they're going to have issues with sexual function. And it's like 80% of them.
Okay, I probably didn't even have the conversation with my oncologist until like 6 years in, and I had a male oncologist and he was very stern, so I was really intimidated. And so I asked him, I was like, he pulled the words out of my mouth. I was like, well, there's something I kind of wanted to talk to you about. I think it's the Lupron. And he's like, your vagina's dry? And I was like, yeah.
Thank you.
Yeah, like,
well, it's better than just being like, bye.
Exactly. So at least he like pulled it out of me. It was kind of uncomfortable, but it's true. Like, how come this isn't brought up? Like,
Yeah, for me, it was also an awkward moment where I'm often accompanied by my mom and dad to the hospital. So then I remember my nurse oncologist at the time pulled me to the side, but because he saw I was with my whole family, it was so fast and brief and awkward. And he was just like, okay, by the way, you can still have sex. Okay, go, bye. And then I was like,
it's so interesting hearing everyone's experience. Yeah. Like, I can't even tell you how interesting it is to hear these perspectives.
Yeah, that's why I'm like, when I met you, I was like, oh my God, you're like finding a needle in a haystack, because there aren't any of you anywhere. Yeah. Honestly, that's why it's like.
Well, there is hope for the libido issue.
Okay, please share.
Yeah, so there was a medication that was FDA approved a couple years ago called Addyi or Flibanserin. The problem is when they did the studies, they found that women who drank a lot would feel dizzy after taking the medication. So the FDA slapped this black box warning that even required providers who are prescribing it to do like a special training promising that you would tell women if they took this once a day pill that they absolutely would not have any alcohol at all. And it's crazy because we all know that if you drink a lot, or maybe not everyone knows this, but hey, if you drink a lot and take Viagra, you may pass out. And like, that's common because it does things to your blood pressure, but there's no black box warning, and you don't have to have special training to prescribe Viagra or sildenafil. And so it's kind of crazy that this was there for so long. And I think it really inhibited not just that specific company, but also like the business of thinking about what we call HSDD, or hypoactive sexual desire disorder, from being like addressed. So there's this medication, Flibanserin. You take it once a day, usually at night. You can drink on it, but if you're drinking a lot that day, maybe just don't take the pill at night, or stop drinking 2 hours before you take it. They lifted the warning. The issue with Flibanserin is that the studies weren't like overwhelmingly convincing that it's super effective. It's not a hormonal medication. It works in your brain with a chemical called serotonin. And the issue is that in the studies, women reported one additional sexual encounter per month, which if you're going from 0 to 1 is a humongous deal. But if you're going from like 9 to 10, it may not be as big of a deal. But if you're going from 9 to 10, you may not be taking this medication.
Seriously.
Yeah, but
goals.
Who knows? Yeah, who knows? Yeah. And so they recently, like literally just a couple of months ago, lifted this warning. So I think we're going to see this medication being prescribed more. I prescribe it a lot. The issue is there's no data in women with breast cancer.
And I think part of that is because no one's really talking about it or offering this drug. Yeah. Because, I mean,
mechanistically speaking, like how it would not interfere with medications theoretically that you take to treat breast cancer. The only one is tamoxifen, because they work on a similar enzyme in the liver, but there's actually studies going on where they're looking at women who take tamoxifen and this medication, and it actually taking them both together wouldn't make tamoxifen less effective. Tamoxifen would make your body less likely to break down this medication, which would just make the medication more potent, so you might get more side effects. That's the real deal with that. So I prescribe it after I've tried all these other things. So I first start with like non-pharmacologic interventions. So you'd be surprised, like just talking about exercise and things that you can try to encourage women that seem really basic, but just to try to improve like their mental health and body image, like working out, or like I recommend Zumba like all the time. I just feel like it's really powerful.
It's so funny you say that. I've been so wanting to try Zumba.
Yeah. I actually had a Zumba instructor's license for a short period of time.
Oh, okay. Now this is where she gets up and throws us
No. It's been like a really long time. I will like drop in on an occasional Zumba class, but I actually like had this vision that I would be like a Zumba instructor doctor, but it didn't pan out because I got really busy. But anyways, I feel like doing things like that to make your mind feel better are huge. And, things like sleep hygiene as well is really important. So, if you watch doctors who are experts in sleep hygiene say you should only be using your bed for sex and sleeping. And that's it.
TV.
Yeah. So if you're someone who like gets in bed and watches Netflix, like I totally do this. It's a thing. Like everyone does it. Then, you kind of trying to reserve certain activities for that space, I think can be really helpful. The other things are, trying not to drink too much, or, eliminating other medications that might be affecting libido. So probably not you guys, but other women who are on a medication called beta blockers, which is like for high blood pressure, can sometimes zap your libido as well. And then SSRIs, which is like Zoloft, Paxil, and some antidepressants. So if I have a patient who's on a medication like that, I try to get their psychiatrist to switch them to bupropion, which is like Wellbutrin. It's an antidepressant that doesn't have sexual side effects, but obviously I wouldn't advocate for doing that without being under the supervision of their psychiatrist. But that's one thing. And then I'll try all those things first. I'll treat the dryness, I'll treat pain, which we can talk more about, but then I'll talk to them about taking Flibanserin and see if it works. So I feel like libido is really, really complicated. But you actually brought up something to me when we did the Thrive Gang stuff together a couple of months ago, and that was Quinn, the podcast.
Oh, Quims.
Yeah, or Quims.
Yeah.
Okay, cool. Yeah.
So it's actually a friend of mine, her niece started this company. Her name's Kayo, and it's called Quim, Quim, which I guess is another word for vagina. And
I didn't know that stuff.
Another thing to add to your bumper sticker.
I learned so much.
So Quim they make different products, but they make like an oil called Happy Clam, which is an everyday oil. And they use CBD, which what I was going to say, like from patient perspective, something Nalie and I have talked about, like just to try and get like the wheels turning is like.
Get high.
Sorry.
No, that's okay. Don't apologize. No.
Okay.
Talk about it.
Better than getting drunk.
Certainly.
And also, I think there are health benefits to medical marijuana.
Yeah.
CBD is popping up in a lot of different products, including like vaginal moisturizers and lubricants. Mm-hmm. And our tissues, like I can't speak to smoking because anyone that knows me knows that I'm like not well versed in that at all, but I've been trying to like learn more about CBD because people always ask me. And our tissues, like in your body, including your vulva, have receptors for
an
endocannabinoids. Yeah, and it's all related to inflammation and pain. So it makes sense that it would work.
Yeah,
we don't have like data yet, but the issue with those products is you just want to make sure it's like from a good company because they're not well regulated. But that doesn't mean there aren't great products out there.
I've been using the Happy Clam, and then they just made like an oil called Night Moves. Have you tried?
Yeah, I have. I can testify. Like I also have been using the Happy Clam.
And it works?
It's amazing.
I'm going to get some then.
Yeah. And there's a new serum that's like a lube. It's called Night Moves. And it's like a little bottle. I keep it by the side of the bed. And
oh, wow.
Yeah, it helps. It definitely, it makes a difference, you know? So I think there's something to it.
Yeah. Another company that's making their foray into CBD products is Foria. Have you guys heard of it?
No,
they have a product called Awaken that has a CBD product, and they have like a non-CBD thing and then a CBD one. I like reviewed the non-CBD one. It smelled really nice, had like cloves and all these things, but I haven't tried the CBD one. But I think it's kind of like the next frontier. What I was gonna say, not Quims. What's the name of the audio porn company that you told me about?
Oh,
is it Quinn?
No, it wasn't Quim. They are, gosh darn it. Can I pull up my Instagram? I don't even have my phone.
How do you not share this with me?
It's so, yeah.
They do audio porn.
I'm going to Google it.
You know what? I will find it and I'll link it on the bottom.
I heard the creator of it on a podcast, and she was talking about, all of the different topics that you can do. And like a lot of women are listening to these episodes, and it like really, because I think it's a state of mind.
Yeah.
Absolutely. And there's obviously, I think, it's not just you, it's a lot of women all the time don't have like, it takes work to get into the on mode. Like men have kind of like an on-off switch. I always tell patients that men are like microwaves and women are like crock pots. It's just like, you have to get.
Takes a while.
Yeah, you just like have to get in the mindset. And so this company that will think of the name, I think is another tool. And then lastly is Vyleesi. Have you guys heard of the injectable?
No.
Oh, I just don't know much about it. It just came out. It's called bremelanotide. It's also not hormonal, but the thing is, it's not a pill you take every day. It's an injection you put in your stomach before you have sex.
Oh, God, really?
Yeah.
An extra injection?
Yeah.
Dr. Rojas?
Yeah.
Like every time before you have sex?
It's like a PRN or like a when you are wanting to get in the mood, inject yourself in the abdomen. And they have a really cute video online, but I was like, I don't know how this is going to go for everyone. Like, even me, I was telling my husband, I was like, should we do a video of like me injecting myself? And like, because if I can't do it, then no one can do it, you know, because I'm not squeamish at all, but I don't want to inject myself in the stomach. So
way to set the mood too.
I know. And so we'll see what happens with that company, but you know, it's the second product out there, you know, and so I think that it's important, you know, they'll set the stage, more things will happen, but right now, you know, it's a complicated problem.
What about is it the Mona Lisa laser treatment?
Yeah. Great questions.
Do you approve of that?
So there are a lot of different lasers that are being used for what's called vaginal rejuvenation, which is a term I hate, and I don't ever want anyone to say, because I feel like it's super misleading, and it has like a lot of highlights a lot of problems with how we address like the vagina and how everyone is unique and things that need to be like rejuvenated. But these lasers were designed for the face or for scars. They were never FDA approved to use on the vagina. And the FDA has actually recently taken a stance against kind of reeling them back from being promoted as those products because of safety concerns. There are some small studies of like women with a history of, or have a history of breast cancer, like 20, 50 patients who are being treated with these and report like improvement in their atrophy symptoms, but I have seen patients with burns. I think that if you are able to use vaginal estrogen, which I can talk more about like at the same time, the concept makes sense. Or if you're like a perimenopausal woman who still has some estrogen floating around, because like estrogen is really important for helping the tissues heal and like promoting blood flow. So if you're inducing like a small injury, microscopic injury at the skin, and then there's no way for it to recover, it makes sense that maybe not everyone's going to respond to a treatment like that the same. And women who are on Lupron or with super, super low estrogen, and you give them this treatment, like they may have a completely different response that's like a scar or worsens their pain. Or the other thing is like providers who don't have a lot of experience with working with the vagina, like not in gynecologists are doing these procedures, and you just like never know what someone's experience is. So I don't know if it's going to be something we use in the future. Right now, I'm not advocating for it. Doesn't mean that it doesn't work for some people, but so right now I'm kind of neutral on that. I caution women, especially women with a history of any type of cancer, because I feel like they're a vulnerable population already, because you can't use all of the treatments that we would normally use sometimes, and so they're already kind of desperate. And so I get really nervous when companies may almost be capitalizing on that. Right. And so I'm sure there are good companies out there, but I just want there to be data, and because it's so complicated, to have like more evidence before I start recommending it.
I think that just listening to you speak, like I'm so thankful, honestly, like as a patient, like not only do I think you're awesome, but like you're really like on the forefront for us, because no one's talking about this stuff, like we said. And that's why I think it's really important to follow your Instagram page, because she's always posting like all of this information. Yeah.
It's important to have like I can give you the medical aspect of things, and I'm obviously very risk averse. So if you want someone to give you like a real deal thing, that's it, you know?
And I think talking about it, like the fact that this reminds me almost, even though it's so separate, but like when I got diagnosed 9 years ago with metastatic breast cancer, no one was talking about it. And now we're having panels and discussions just about MBC. And so I feel like
are paying attention.
And I think by us doing this podcast today and you creating your page, and we're going to still keep talking about it until people start listening. And when people start listening is when we can start, people start making more products or addressing the issue.
I think you guys are really powerful in that aspect, like really driving, through social media, like companies look to women like you to really drive what they do next, what products they develop and who their target audiences are, and what we should actually be studying. I think it's like the impact is great, not only just for individual women, but also like the group as a whole, which I think is really important.
So I think we got like so much good information today.
Can
Say
I
something.
talk about a couple more things?
Yes.
Oh my God, absolutely.
Yeah.
Yes.
I just want to make sure I talk about a couple more things like hormonal treatments for the vagina, because I feel like that's super controversial.
Okay.
So the thing about vaginal moisturization is all of these options I talked about are not hormonal. There are some, but I do sometimes use low dose vaginal estrogen, at least even for a short period of time. To kind of like try to remodel the vagina. I tell women that if they've had vaginal atrophy for a really long time, like it's like someone completely remodeled your house. Like the living room is different, the kitchen, so you need to, by giving vaginal estrogen back and maybe even doing like a dilator program, which I know can be really scary, but I talk about a lot on the music Instagram, then you can kind of work to kind of, for a short period of time, use vaginal estrogen, work on remodeling the vagina, at least try to get like the length and width back to normal. It makes a lot of people nervous because we just don't have a lot of data, but there's no studies showing that vaginal estrogen increases the risk of either recurrence or progression, but we should just be careful with it, just like everything else. There's also ASCO, the American Society of Clinical Oncologists, also endorses vaginal DHEA, which is a form of testosterone. And so in the vulva, testosterone is converted to estrogen. So it's like giving a tiny dose of estrogen just there that's probably not going to be absorbed like vaginal estrogen might be sometimes. And vaginal testosterone or vaginal DHEA can sometimes be really helpful for pain. And there's a company that has a product called Intrarosa, which is progesterone, and they're like suppositories also. And it's not estrogen. It is a hormone. It's testosterone. So some women maybe with, they're doing a lot of research on triple negative cancers and whether those cancers respond to testosterone. So I think that some of this remains to be determined, and don't try anything that has a hormone without talking to your oncologist. But these are sometimes options that we can use in certain situations.
That's amazing. Yeah. And I always kind of was leery of that too, being that I'm on so many drugs to stop my estrogen. Like, can I put estrogen,
And if anyone has any questions, they can write on the music Instagram, and I can, by having the question, know more topics that I need to cover. Can I ask you guys a question though?
Of course.
Okay. So people, our patients, women write into me and they want to know, okay, so I went through treatment and I want to start dating again. Like, what do I do? How do I explain it? And I don't know what to say. I don't know. Do you guys have any advice? Because I've gotten this question multiple times.
Our episode on Valentine's Day addressed sex, love, not sex. No, it was all about love and relationships, and we spoke and we gave tips about, dating and getting into relationships, because Steph's story was she met Mark
mid 6 years into my diagnosis.
And whereas my partner was with me from the start. So we shared both our love stories, which is episode 17, I believe.
Okay, I'm gonna have to go listen to that.
And we give really good tips there. But what we can give tips right now, for me personally, when it comes to sex and cancer, I have to say, like, listening to all your tips, I will definitely apply it to my sex life. But it takes effort. Yeah. So much effort. And I think it's important as women to also put that effort. And a lot of us sometimes depend on the man to initiate. And yes, we're going through this. Yes, it's hard, but I think it's equally as important to put that effort in, just as much as we mention how important it is to change your diet and to exercise regularly. I think when it comes to your sex life, I think as breast cancer thrivers, as cancer thrivers, as women, period, doing everything you just mentioned is so important. What's your thriver tip for sex?
Well, I definitely will start by saying that I'm out of all our podcasts, I've learned something so much today, and my biggest takeaway is I have work to do. I definitely learned all these things and I don't apply them, just because I'm so overwhelmed with everything else. But this is so
seriously
important, and it's only fair to our partners. So
and to us.
100%.
You deserve good sex.
Yes, exactly.
Definitely.
So I'm going home with the to-do list, but I definitely one of my biggest pieces of advice is to get out of your own way, because I felt like I was in my own way. We have this negative connotation that, okay, I had a breast cancer diagnosis. Who's going to want to take this on? And not minimizing anybody's diagnosis at 1, 2, 3, or 4. But I found love like in the middle of a stage 4 breast cancer diagnosis. And there are plenty of men, women, whatever your sexual preference is, like people who will take this journey with you, who aren't afraid of your journey. So I think like a lot of it is working on yourself first. And realizing that you are worthy of love and that you are lovable and that there is somebody that is waiting to love you once you let that self-negative perception down. So that's like my biggest piece of advice. But I do think that there's like so much more to talk about. Can we talk about that we're having we're having an event in the next few months. And it will be in New York City. All details will be announced shortly, but we hope to have you there so people can come and ask questions in person. And I really think too, like having another podcast where we could like get questions from listeners.
I learned so much from questions. If I don't know the answer, I'll figure it out.
Yeah. So maybe like a future episode, and we can have people write in their questions and have you back since you're local to me. And
we can also do more Instagram lives with your page as well. So it's not over yet.
Like she's like busting her ass to like make noise for us, and like thank you. Like is all I can say.
I can't even. I'm so inspired by you guys. I can't. So like I'm honored to help in any way I can. I had another idea though.
Yes.
And what if you guys had your partners do their own podcast about? Have you guys already did that too?
No,
we
want to, but obviously
admitting that I had dry vagina and low libido, it's like baby steps.
Baby steps.
Yeah. Because it it's also really hard for them. And where we've decided to be public figures. Not so much my partner, who likes to keep it more, he's a bit more shy and he rather keep his life private, but maybe, who knows?
Mark would be all about it. But
so if Mark's all about it, maybe V will. Yeah. Any final words?
We'll plant the seed.
Yeah. Final words of advice by Dr. Rojas.
Yeah, my biggest piece of advice is, like you always say, be your own advocate, not only with regards to safety and making sure you get the right treatment, but, speak up. Who cares? Like, if we are doctors and we hear crazy stuff all the time, no one is going to judge you or like think you're, inappropriate if you say, hey, I'm having this problem and I want to talk about it. A good oncologist, even if they don't have the answers, they'll try to figure it out for you or find a good resource for you. And also, the more patients that ask about these problems, the more we come up with better solutions and programs. And so just bring it up. And even if you get shut down and they're super uncomfortable, they're going to go home and they're going to think about it. Sure. And then probably the next time they see you, they're going to have a solution for you, even if they have a super awkward, because we're all nerds. And sometimes we're not good at dealing with stuff like that. But just do it. I mean, you have nothing to lose by just bringing it up.
I think this is divine timing during this International Women's Month week day tomorrow. We have to take the time to appreciate you and the incredible work you do for us women. And you're just changing the game as a breast surgeon and creating new programs.
I'm like blushing. Guys,
oh my gosh.
I am
such
so
an honor.
I feel like it's real teamwork. This is amazing. I feel
it's
so
great
honored
to have doctor perspective and patient perspective. It's like the winning combo. So
hopefully I get invited back. We'll see how this turns out.
You're gonna have your own podcast. Yes. Well, thank you so much, everybody, for listening or watching. If you know somebody who's suffering from vaginal dryness, low libido, or painful sex, please share this episode with them. We're available on all major podcast platforms. And if you haven't already, sign up for our newsletter on www.thethriversguide.com.
And always remember, where there's a thriver's will, there's a thriver's way. We'll see you in the next one. Bye.